You have been experiencing symptoms of joint pain, swelling, and stiffness, and you meet a doctor and you have been advised some tests. You come across terms like rheumatoid factor, anti-CCP, seronegative rheumatoid arthritis, and you get overwhelmed. You don't know what to do. Let's break it down in simple terms. Hi, I'm Dr. ViKramaraj Jain, consultant rheumatologist practicing at Bangalore. And today we'll talk about rheumatoid arthritis diagnosis and treatment. How is rheumatoid arthritis diagnosed? The diagnosis of rheumatoid arthritis is not based on a single test. It's usually a combination of clinical features of joint pain, swelling, stiffness, and associated with blood tests like rheumatoid factor, anti-CCP, erythrocyte sedimentation rate or ESR, C-reactive protein or CRP. Along with this, doctors may sometimes advise imaging like X-rays, ultrasound, or MRI. A combination of clinical features, blood tests, and imaging put together helps us to make a diagnosis of rheumatoid arthritis. So, what is this rheumatoid factor? Rheumatoid factor is an antibody which is found in patients with rheumatoid arthritis. However, it is not seen in all patients of rheumatoid arthritis. Nearly 20 to 30% of patients with rheumatoid arthritis may not have rheumatoid factor positivity. Rheumatoid factor, however, can be seen in other conditions apart from rheumatoid arthritis. So, just having rheumatoid factor positivity does not mean you have rheumatoid arthritis always. Another test called Anti-CCP is a more specific test for rheumatoid arthritis. That means it is usually not found positive in conditions apart from rheumatoid arthritis. However, some patients may be negative for both rheumatoid factor and anti-CCP. This is called a seronegative rheumatoid arthritis. However, it is as dangerous as seropositive rheumatoid arthritis and is treated in the same way. Hence, it is important to understand that tests alone are not enough. Your doctor will examine your symptoms as well as your tests and imaging and then make a diagnosis of rheumatoid arthritis. So, how is rheumatoid arthritis treated? Just like early diagnosis is important, it is also essential to start early and aggressive treatment. The treatment includes drugs like disease modifying anti-rheumatic drugs or DMARDs, steroids or NSAIDs or painkillers which are used for short term pain relief. Biologics are special medicines which are used if DMARDs are not tolerable or ineffective. Along with this, when the patient is started on these medications, there is a requirement of regular monitoring and blood tests. So today we learned how rheumatoid arthritis is diagnosed. The diagnosis does not depend on one single test, but it is taking in the whole picture. Moving on, in the next video, we will discuss about the treatment of rheumatoid arthritis in full detail, when to start, what medicines to start, when to stop, etc. If you found this video useful, please like, share and subscribe. Your awareness can help others too. Thank you.